Hello. Apparently, I've been on mute. Can you, if you're watching, can you let me know if you can hear me? Because I think I'm having issues with my mic. It should be working now. Can you hear me now? Are we good? I will go back to the beginning. Hello, Sarah. Good to see you here. It's nice to see you. You're like, shouldn't you be keeping us, shouldn't you be arriving fashionably late? Just to keep, we should be waiting for you. You are the queen, after all. Hello, mastermind. Is the problem, Sarah? Once you get talking, you can't stop. I think like the interview with Sarah was like, I edited it a little bit, but it was 2 hours long, I think. If you haven't watched it, you should. It's a really fun interview. I'm going to see who else is here. So, hello, Amelia. Nice to meet you. So, how are we all? I am glad you have sound now. At least you have. I once started a live stream and I hadn't actually hit go live. So I was merrily talking away and I wasn't broadcasting. And I couldn't understand why the comments weren't like anything to do with what I was saying. How are you all doing? What has everyone been up to? Karen, hello. Good to see you. I haven't seen you for a while. Where have you been? And what have you been up to? Can you talk about betrayal trauma? Does it cause PTSD? Can kids get it like me? So like betrayal trauma is usually referred to when around infidelities, but I don't think it's limited to infidelities. I think it's really a sort of experience. I mean, it's not an official diagnostic term, but I think it is a thing. It's a real phenomenon that people experience when you find out that someone that you rely on or depend on is doing something that is so beyond what you ever expected them to do and a real violation of your relationship or your moral compass. So if you find out your partner's been cheating on you, there's been multiple affairs, or maybe you find out that your partner's been committing a crime, or they've been fired from their job and they never told you. There's been some massive deception. It really rocks people's sense of, could knock your sense of yourself, really make you feel like, do I make good judgments? Do I make good choices? Who am I? What is this relationship that I've depended on? So yeah, I think it can really be very destabilizing for people to experience. And yeah, I think kids can certainly be betrayed and have that experience if a parent that they've loved and trusted abuses them as a form of betrayal. And abuse is also a trauma. But things like finding out that a parent was leading a double life, for example. There may not be an act of abuse, but there's such a major betrayal. That sort of thing. I'd also be really curious. So like leave a comment in the chat about your experience of betrayal trauma. In terms of whether it causes PTSD, that I'm not so sure about in the kind of formal diagnostic criteria. But it can certainly really undermine people's ability to trust themselves, trust their own judgment, trust other people, kind of know where they stand in the world. I think it is incredibly destabilizing, just depending on the nature of the trauma and all the other context around it and where someone's coming from. But I'd be curious, what are people's experiences of betrayal and betrayal trauma? Because I think it's a real... I think what it does is it just destabilizes hugely your sense of yourself and where you are in the world and what you think your relationships are, and who you can count on and who you can't count on, and what does it mean about your judgment. It's really baffling. It's it really can be very, just really leave people feeling very, very unsteady and like they don't know who they are, what the world is about. Hello, stop normalizing violence. Exactly. I was just practicing. I was just warming up. Oh, wow, you're working in Germany. How are you finding Germany? I like Germany, but it's a unique culture. Things are orderly, and you better be on time. How yeah, let me know how you're finding being in Germany. So, Amelia, hello. What would you suggest for someone who doesn't have the resources for therapy and they struggle severely with BPD? The internet is a wonderful and horrible resource, and I'm going through it. Um, where are you based? Um, I'd be curious to find out if there was any way to get um, healthcare where you are, because you should be able to get treatment. If I mean, if you were in the UK, for example, you could try to get treatment through the NHS. How successful you'd be at getting good treatment through the NHS is harder to say. You know, there's a lot of good resources out there for BPD, and as you've probably found, there's a lot of terrible ones too. Um, you know, so people do actually recover from BPD even without treatment. It is one of those disorders that people, you know, as people mature and have new experiences, I think it can really um, you know, things can change. And I think, you know, investing in your relationships, investing in uh, good friendships and good relationships, maybe in your workplace, like good mentor, that kind of thing. Um, really giving some attention to that if you're able to. And I appreciate BPD can really get in the way of that. But the experience of having good relationships and good friendships is a really big source of support for people with BPD. I would agree with Sarah as well that CBT books are super helpful as a starting point. There's lots of good self-help resources on my website. I have a whole list of like really good books that I recommend. So you could kind of take your pick in terms of which ones would be the most suitable for you, you know, and, you know, see if you can get some help and support with that way. But it's really tough, you know. I think the other thing is I think you can't, you know, BPD is a serious illness and really does deserve to be treated well and to have good, you know, to have good support. Ah, so you're in the States. Oh, that's a shame. That's a shame. But have you had good experiences of therapy? Um, I'm really sorry, Amelia, because it sucks. You know, it sucks. It's, you know, it's a serious condition. I mean, I can give you some strategies and, you know, good self-help resources that are a great starting point for people and may actually help you as well to maintain some of what you've already built up in therapy. But I really think there's nothing like good comprehensive treatment for BPD. It really isn't something you can just be expected to handle on your own. That said, you're clearly motivated, you're clearly looking for information. And I think there's probably quite a lot of personal growth and things that you can do by yourself. So I hope you're able to. And I suspect you probably will be, but freaking sucks. It really sucks that you can't get access to good therapy. And I'm so sorry you had to end a relationship with a therapist, especially if it was a good one. Really tough. So there you go. Stop normalizing violence is suggesting Dr. Jennifer May. I haven't heard of her, so I can't endorse, but you know, I'll trust the people in the comments. So I'm gonna go back. The mastermind, would or could betrayal trauma lead to things like compartmentalization? Tell me more what you mean by compartmentalization. Um, I think so, you know, in the sense that you could start to put like separate areas of your life. I think it can be very um disorientating and you can start to be like, well, home is so crazy and so much is going on. You know, if the betrayal has been from a partner or a parent or someone in your immediate family, And then you kind of almost go somewhere else and act like nothing's happening because it's just so crazy. I've certainly worked with people who've had really extreme situations at home, almost like to the point that you wouldn't believe it. I mean, like if someone made up the story as a novel, people would say that never happened, or they're so unrealistic, you know. Um, but and then what they do, and there's strengths and there's drawbacks to this, is in other areas of their life, they look completely that it's almost like it's not happening, and they don't tell other people about it because the story's so crazy, or it doesn't sound believable, or because there's a lot of shame attached to it. So they don't necessarily share that. And I think that can be helpful to a point because it can keep you going. Um, but I also think it's really helpful for our experiences not to be unspeakable and not to feel like something that you're experiencing in your life and your family is so awful you couldn't possibly share it with someone else. Um, but let me know if that answers your question, or if there's more that you'd like to say about compartmentalization and what your experience of it, because it's one of those words that I think people use, and I think it's obviously it's a real thing, but people sometimes use it to describe different experiences. So Karen, oh, you're not enjoying Germany. If you thrive in lawless and flexible cultures, Germany's not for you. Hmm. Good bread though. The Germans do good bread. That's yeah. The Germans aren't known for their lawlessness. You can just Spain, Portugal, they're a little more flexible. Oh, I'm sorry you're not enjoying Germany. So tell us what gaslighting is, because people think it's disagreeing with them. It's not disagreeing with people, it's disagreeing with me. No. Um, so, gaslighting is a term. It comes from a very old movie um, called Gaslighting. It was called Gaslighting, wasn't it? I can't even remember. Anyways, from an old movie where basically it's a man who marries a woman. He's there to get her fortune. He wants her money. And he tries to convince her she's crazy by turning off and on the gas lights and then denying he's doing it. And then convinces her basically that she's losing her mind. So I think as a term, it's then translated into painting a picture that really makes someone question their version of reality or their experiences to the point where they start to question their own sanity. So it's not just disagreeing with someone. We can all disagree with people. We can all have a difference of opinion. Um, and then I think that's a useful kind of sense of the term gaslighting. It's not about disagreement. It's about kind of manipulating knowledge and saying things and denying things that you know to be true and twisting the truth, but with the aim of really making the other person question themselves and question their own mind and question their own reliability and question their own sanity. It's not the same as just having an honest disagreement with someone where you're not causing them to question their perception of events. Where you might be asking challenging questions. You might be talking about how you experience things differently, but it's not kind of really causing someone to question themselves or to think of themselves as mentally ill or crazy or bad. So let me know, does that kind of fit? I'm about to make a video about gaslighting, but it's a bit of a different one. I'm going to look much more at institutional gaslighting. So I'm kind of curious as to how it's going to go down, because I'm going to base it on some events that are happening in the UK and that have been happening in the UK for like 20 something years, to see, just to use it as an example of gaslighting, um, and see if I can use that to kind of explain the phenomenon. So it'll be interesting to see how that goes. And yeah, Mac, I think you're right. I think there were two movies called Gaslight, and they're the same story, I think. Let me know. I might have that wrong. So, Mac, be careful who you share stuff that is or has happened to you. I find people generally can be overwhelmed and don't know how to respond. I think that's true. I think it's true. And I think that's kind of one of the reasons people do compartmentalize, because it's like, I'm not going to tell everybody about this thing's happened in my life because it's so crazy. People don't know what to say. People don't know how to respond. And I think that can also drive shame and a real sense that there's something really awful about you and your family that you can't speak of it. So I think you're right to think about being careful, but at the same time, I think it's such a shame that when people really don't feel like they can't share what's happened to them with at least some other people, at least some people they trust. It's a real can be a real problem to kind of be so compartmentalized. And then also, the other thing I kind of see quite a lot is where people have those kind of secrets and they're single and they're about to start a new relationship. They're often either so reluctant to share what happened to them because it's so crazy and they're worried about the other person's response, or they share everything, but then the only person who knows the story is the new romantic partner. And new romantic relationships don't tend to be the most stable of relationships. So it can just put a lot of pressure on a new relationship. Um, so that can be a real issue. But I think you're right. You have to be careful who you share stuff with because not everyone will understand. And people can be overwhelmed and they can sometimes not know how to respond. And they can sometimes say things that are really insensitive and really like, sometimes quite stupid. Like, I mean, I'm thinking of things that I'm probably not gonna share on YouTube, but like really at one point in my life, something really awful happened to me and people didn't know how to respond. And I started collecting stupid responses because the responses were incredible sometimes, just what people would say. And it was like, this is crazy. It's horrible. But yeah, there is a real it's horrible when you don't feel like people can understand. So the mastermind, you're still learning about it. I think it's separating the good and bad part of your parents. The kid chooses the good and forgets the bad. Yeah, well, that's kind of splitting. If you're very psychodynamically inclined, you call that splitting. I also think it's sometimes it's a little bit like we all like to think of ourselves as sensible, wise people. And if you find yourself in a situation where you haven't made a sensible or wise choice, or you found out that a choice you made was, you find out you've chosen your partner and you find out actually that they're cheating on you and they've cheated on other partners, or they're lying, or there's something about them that they haven't told you. That has such huge implications. It has huge implications for your life that sometimes it's easier not to see it. So we kind of make ourselves willfully blind. So I think that's often why people don't notice obvious cheating behavior. I think it's also sometimes why people don't notice abuse when it's happening to them, or maybe even it's happening to people close to them, like their children, because it's like it's so overwhelming to think about the bad stuff that someone close to you is doing that it's almost easier not to see it. So you kind of really genuinely don't see it, you know. Um, but yeah, let me know what you think of that. So as you grow older, you separate the feelings from the actions of parts of your life. I'm not sure what you mean. Sarah, can you tell us about projection? Because I just learned I was doing that shit a few years ago. So projection is like when you take what you're feeling and you put it onto someone else. So if you're angry, you accuse someone else of being angry. Or, if you're doubting a relationship, you accuse the other person of doubting the relationship. So it's just putting your feelings onto someone else. So the mastermind. Say that a past memory comes up, but you push it to the side and keep going. That could be a form of compartmentalization, but sometimes, I think also sometimes that can be functional. To choose not to give attention to some memories because there's other things that are more important. And not it's about, I think, how pervasive that is and whether it interferes with your ability to live your life, you know? Um, I think sometimes I'm thinking about people I've worked with, people I've known personally where there's been infidelities in their past, and the memory pops up in a new relationship or the memory pops up somewhere out of place. And actually, there's no reason for them to be concerned about infidelity. And so, actually, the best thing to do at that point is not necessarily to push it to one side, but it's maybe to acknowledge to yourself, I've had that thought. Well, I know it comes from my past. It's not something that's in the present. So, I'm not going to give it too much attention. I think that can be really helpful. But it's equally unhelpful, or maybe even more unhelpful, if you are saying, well, I'm not going to think about this possibility that is so painful and so unreal that I can't possibly acknowledge that the reality of what I might be going through. Does that make sense? Julie, hello and welcome. Oh, I'm so sorry. I'm so sorry that happened to you. And yeah, so like, did your ex-husband manage to twist the blame onto you for his abandoning you and your kids? That's grim. I'm really sorry you went through that. And yeah, it does. That kind of thing really does mess with your head. It really does. And are you saying that, Julie, as an example of gaslighting, like making you think it was your fault for his behavior? Because that could well be a form of gaslighting, and certainly it's blame shifting. Sarah, when you compartmentalize, you put memories of feelings in another in a little box so you can still interact with them, usually because they still find value in them. You see, sometimes that might not be a bad thing. Like if your kind of feelings for someone, like if you have kind of negative feelings about someone and maybe they're a little out of step with reality, you know, you're like irrationally angry with someone. I think it can be helpful to just say, hang on, maybe I want to put a little question mark over some of the thoughts I'm having there and interact with them in a pleasant way and see what happens, because the relationship is valuable. But that's not so helpful if what you're putting in a box is their abusive behavior or their profoundly hurtful behavior and you're not addressing it. Let me know what you think. AMAC. Yes. The Gaslight films. Ingrid Bergman's was the 1944 one. I'm not 100% sure, but these 1940s movies. Amelia. I used to be the type you overshared, learned how unfair it was to others, and now I've gone to the other extreme, how to gradually open up again. Gradually. Gradually. You can share a little bit at a time. And I think also, you think about it, in different relationships, it's going to be different, right? So in some relationships, you're going to share a lot. In other relationships, you may not share so much. So you might want to think about how close is this person? And you might want to also go really gradually. And I think avoid having like just one special person with whom you share everything, because that gets a little unstable and a little more risk that you end up oversharing and becoming overly reliant on that person. So that's totally compartmentalizing. So when you knew your husband was cheating online, I didn't care because at least he was leaving me alone and he still had monetary value for me. Yeah, that's like pretty extreme compartmentalization with a nice little twist of antisocial there, Sarah. But I know you're not offended by that. Yeah. I'm sorry, Julie, that really sucks. DC, hello. Nice to see you. Do narcissists enjoy rivalry in a professional setting? Asking after watching your video about musicians being not being narcissistic and being grandiose and calling out other musicians. You know, I think this varies. Like some people enjoy rivalry, some people enjoy a little competition, and that's not a bad thing. You know, athletes presumably enjoy some form of competition and rivalry, and I think sometimes that can also be quite respectful of the other person. So I think it's possible to for anyone to enjoy some rivalry and competition. And I think it's also possible for it to become quite a toxic, one-upman, grandiose kind of. And also, I think the inability to tolerate when someone else wins and not be a good sport about it, even if it stings a little bit because you worked really hard for it. I think is kind of that would be probably a little more indicative of narcissism. But you know, I hesitate to slap narcissism labels on everything, which I kind of hope came out of that video as well. That you know, I don't think we can really say everyone's narcissistic. I don't know if that answers your question now. Stop normalizing violence. Sharing BPD diagnosis with the wrong people has been a big mistake. Yeah. So, yeah, I think the same with any personality disorder diagnosis. I think you have to be careful who you share that with because, so, you know, there's a stigma associated with it. People often get their information, unfortunately, from the internet, and sometimes that information is highly stigmatized and pretty horrible, actually. So, I think, yeah, you do want to be careful who you share that with, for sure. Sarah can be confrontational. I'm just going through the comments. I'm glad you don't take offense, Sarah. The mastermind. About separating, I'm talking about separating the feelings with what happened to you, their trauma. It's more factual things than a memory. I hope that makes sense. Do you mean like you separate your feelings for the person from what? I'm not really sure. Who's Mrs. M? Or do you mean Sarah? Oh, I guess you're meaning Sarah. Okay. Sorry, Amelia, no favorite person. Sarah, don't share you're an empath either because I smell blood in the water and you don't want that type of attention. Good point. Good point. Yeah, but I think like Mastermind, I think what Sarah's describing is kind of a form of compartmentalization, but it's also less about valuing the relationship for the relationship's sake and more about valuing the monetary value that she gets from it, was what she said, which I think is quite different from saying I'm going to look past the cheating. And also, I'd never recommend that someone looks past cheating or lying or deception of any kind in their relationship because, you know, you keep that stuff hidden. That's not going to, in the end, it's not going to be good for the relationship, you know. I have never heard Sarah called Mrs. M. The Queen, yes. What else do you guys want to talk about? I am very curious to know. I'm also really curious, did you like the last video where I did the reaction to Mary Spender's video? Because it's the first time I've ever done a reaction video. I'm kind of curious, how did it land? Sarah, where do you think my hostility stemmed from? Can it be hereditary plus childhood trauma? Yes. It may be temperament. It may be trauma. It may also be protective. You know, the if you've been through a huge amount of trauma and a lot of abuse, then being hostile can be a really good coping strategy with abusive people. Like, it is probably good to be hostile to someone who's quite abusive, you know? I'm thinking of I'm thinking about when I did, um, self-defense training and training in handling, like, when I was, like, working in, like, the health service, and actually one of the things that sort of the advice given to women was, if a guy is kind of treating you in a way that is sort of making you uncomfortable, making you feel sexually uncomfortable, don't be afraid to be hostile and offend them. So I don't think being hostile is in and of itself necessarily pathological. It's pathological if it's applied to too many situations where it's not needed, right? But a degree of hostility is probably not a bad thing, you know? But I would say, yeah, it probably is a degree of temperament plus trauma, plus a reaction to trauma. And if you were in schemotherapy, you'd probably kind of see that you are, like, you'd see the hostile part of you as a part of you and as a kind of overcompensating coping mechanism, or a part of you that gets hostile to protect you. And you'd understand it as that. And then you'd be thinking, what role do you want the hostility to play in your life? I don't know if that makes a lot of sense, but let me know what you think. I'll go back. Did I ever fear for my life when working at the hospital? No. For times I feared I might be beat up, not beat up, like physically assaulted, because there was some volatile situations, but not my life. No, not my life. And also, I mean, I think the role I was in was much more protected because I wasn't sectioning people. Like, I wasn't kind of committing them to the hospital. I wasn't forcing them to take medication. I wasn't restraining them. That wasn't the kind of work that I got involved in. And staff who got involved in that were in much more physical danger at times. And also, I generally, just because of the nature of my work, I generally had a good relationship with most of the patients. So if someone got in my face, the other patients would have. I know it sounds dreadful. I'm thinking about situations in which there was kind of someone behaving in a threatening way, and other patients stepped in. And obviously that's not ideal, and I would have called the other staff to step in. Um, but no, I never feared for my life. I'm looking through the comments. I'm going back. Mac, do I know anything about limerence? Like, so limerence, as I understand it, and the way I use the term, but I've heard other people use it to refer to different things. But limerence is that early, excited phase of a relationship. And most of us experience that. And I don't think there's anything wrong with it. But I think you also need to realize it's not going to last forever. And it's going to be a short-term thing. You guys should find me videos to react to. I could do it live. I could do it live. We could do it live. We could have fun with that. Prof. L. Dilly, hello and welcome. Can narcissism as a dispositional personality trait be confusable with drug addiction? Substance abuse disorders are really common in people with narcissistic personality disorder. It's like the highest thing that is most likely to be comorbid with. It's well over 50% of people who have NPD will also have a substance abuse disorder. So I think there's that. I think the other thing, of course, is even without narcissistic personality disorder, someone who is addicted to a substance can start to behave in ways in order to get the substance. They can become very self-absorbed. They solely focused on getting the substance. They can do horrible things to people around them. They can be completely disengaged from their relationships in order to get the substance. So I would not, for example, be diagnosing narcissistic personality disorder in someone who had a drug addiction. You want to treat the addiction first. because you wouldn't want to assume that the behavior was personality driven as opposed to addiction driven. But I'm also really mindful that actually a lot of people with narcissistic personality disorder will have issues with substance abuse. And so you kind of want to get a really good history and explore everything. So just let me know if that answers your question. I'm sure it was a good joke and I just don't get it. So, stated differently, can people who are addicted to drugs appear to be narcissists but not really be? Yes, yes, because if the addiction is driving some of the behavior, that's pretty terrible behavior. But likewise, what I'd also point out is that a lot of people with narcissistic personality disorder will also struggle with substance abuse. Cluster B, how do you like the diagnosis process of us American Yankees compared to yours? You know, I mean, Sarah, like, was telling me about her experience of being diagnosed. It's way more in depth, actually, in terms of, um, kind of really going through. I mean, I think in the UK, psychiatrists will tend to do that more than psychologists, but even then, we rarely diagnose any personality disorder other than borderline or emotionally unstable personality disorder. It's just really not done, and in a way, I think it's a shame. I think it would be helpful to have more conversation around personality disorder and effective treatment for personality disorders because there are some, and maybe also more acknowledgement that we're often treating people with various personality disorders who we're treating them for anxiety and depression. I think that would be kind of helpful. So yeah, I was impressed. I was impressed. Stop normalizing violence. Your old psychiatrist told you were too low in narcissism. And I needed to work on healthy narcissism. That's an interesting way they actually put it like that. um, how do I know if I'm over that now that I'm old? You need to be more narcissistic. It's really, I think people find this really hard to get their head around. But if you look at things like the narcissistic personality inventory, it's a spectrum, and high scores, very high scores, will correlate with difficulties in interpersonal relationships, lack of empathy, more antagonism. But at the lower end, it correlates with low self-esteem and anxiety and depression and an inability to take action. Like people really struggling to work towards their goals because they don't see themselves as good enough. So basically, they need a little more narcissism and grandiosity. So I'm glad your psychiatrist said that. Amelia, why do you think people seem to talk about MPD as if it's ASPD as an antisocial personality disorder or psychopathy? Whew, because most people don't know the difference, but there's a big difference. I think a lot of people with ASPD and psychopathy also have narcissistic traits, and possibly also full-blown narcissistic personality disorder. In answer to your question, what help is available for people with ASPD psychopathy? Not a lot, unfortunately. Probably more in the forensic system. You might find some. Otherwise, and I think there's also a need to differentiate that there's a kind of antisocial personality disorder that's probably more driven, like a form of it that's probably more driven by trauma and life experience and adversity. Um, and it's probably a little more like borderline and narcissistic personality disorder. And then there's a version of psychopathy that is probably far more genetically driven, where the person really does not have empathy and remorse. And that's much harder to treat. It's much less treatable. The evidence would suggest that's really a tough one. There's not a lot available, certainly outside of the forensic system, unfortunately. You're welcome, and I'm glad it was helpful. Is there any more questions or comments? How come YouTube's removing your comments? I got banned from TikTok. No, I didn't. I did have not banned. I did have a video taken down from TikTok, and they're like, they sent me a message saying you have violated our community guidelines, and if you do this again, you will be removed permanently from our platform. I was like, oh my god, what was it? And it turned out it was just like a clip from a video where I referred to Otto Kernberg and the fact that he grew up in Austria during the rise of the Third Reich and Nazism, and it's like, yeah, I wasn't approving. I wasn't approving of the Third Reich or Nazism. I wasn't advising this as a good thing. I was merely talking about the context in which Otto Kernberg developed his ideas about malignant narcissism. So I appealed it and I won. They did send quite a message like, you have violated our community guidelines. So stop normalizing violence. Can you talk about dissociative states? Yeah, I mean, like dissociation is a normal thing that we all do, right? You ever zone out? You ever just like zone out while you're watching TV or you're like on a train journey and your mind just goes elsewhere? That's like a form of dissociation. But at its more extreme form, it can also be a way of coping with severe trauma, like dissociating from the experience because it's so awful. Your mind goes somewhere else and it can make it really hard to be present. So if someone's finding like, so where it becomes a problem is, so let's think about dissociation can be helpful, right? So let's imagine, I don't know, you're having dental surgery. It's a bit grim, right? You take your mind off somewhere else. That's a form of dissociation. Pretty good, helpful. Just come back, right? But where it's not so helpful is when your mind is going elsewhere during all kinds of conversations where it's impossible to talk about things that might trigger painful or difficult emotions, where you are not able to focus on the here and now because very minor triggers, like small things will trigger these big emotions, big trauma memories. And so you end up kind of just not in the here and now. So it's kind of thinking about it like I think about it as on a spectrum, and there is the kind of healthy end of the spectrum, and then there's the completely dissociated, I'm just not present, not here, really spacey, and even more extreme than that, where you're kind of acting and you really just are not present and you're not in control of your own thoughts and feelings. It feels like you are just somewhere else. So yeah. See, Sarah, you got to work harder and get some videos removed. You were giving a timeout during one of your own lives. How did that even work? Like, how would YouTube actually know to give you a timeout? I'm kind of curious now. How did that work? Yeah, so that's like physically lost. That's pretty dissociative, right? Because that's the inability to bring yourself back. And yes, that does not surprise me that it's PTSD being activated. And I'm sorry you're going through that, because that really is, that sucks. That sucks. You got a timeout on TikTok. Like, sent to the naughty corner. I can't go live on TikTok yet because I don't have enough followers. I only have like 800 and something followers. My TikToks never do well, but like I'm lazy with TikToks. They just like shorts from my main videos. So they're not, I don't really think too much about them. The difference between splitting and DID. So DID as in dissociative identity disorder. Splitting is a psychodynamic concept. It's like when you split the good from the bad. So you're kind of like seeing people as all good or all bad, and maybe flitting between seeing the same person as all good or all bad. So that's splitting. Whereas dissociative identity disorder is when someone has dissociated identities. So they may actually have whole personalities that are kind of dissociated from each other. Does that make sense? Amelia, perhaps you're just a bleeding heart, but I think everyone deserves a chance at getting help if they want it. I agree. And I also 100% agree with you that you are multidimensional and not just a diagnosis. And I think the way I see diagnosis is that they're a signpost towards what treatment's going to be the most helpful to you, right? So it's good for me to know if someone has kind of borderline or emotionally unstable personality disorder or narcissistic personality disorder, that probably they're going to need fairly long-term treatment, probably more psychological therapies orientated, with a lot of emphasis on the therapeutic relationship and alliance, compared to someone who is, having their first experience of a depressive episode. They're probably going to get better with either medication or a relatively short-term psychotherapy, or a combination of both. That's really helpful to know. And likewise, if someone is presenting and they're really grandiose and they have great big ideas, but actually that's part of a manic episode, I'm not even gonna try psychological therapies because they're not gonna work. You really need to be having, they really need medication because that's what works for bipolar and mania. So, the diagnoses are helpful insofar as they actually meaningfully direct treatment. But after that, we're treating people, not disorders, you know? That's the way I see it. So so your dissociation is constant because of your PTSD. I'm sorry. Are you getting some help with it? I hope you're getting some good support. I mean, that sounds extreme. I mean, that does sound really tough. Yeah, I agree. I can see what Stop Normalizing Violence has said, that that's like highway hypnosis. Like that's totally fine. As long as you're still paying enough attention to the road. But yeah, we all kind of zone out because the drive is boring and you think about all kinds of things, which is, there's nothing wrong with that. Um, but I think what Stop Normalizing Violence is talking about is a dissociation that really interferes with your quality of life and interferes with your functioning. And it can be very distressing, actually. Cluster B milkshake. Have you ever treated someone with OCD? Many times. And come off as very controlling because they need order. Are you thinking about OCD or OCPD? It can be true, actually, both. People with OCD can also be kind of controlling in a way because of the need to control the thing that's related to the OCD. But yeah, I've treated lots of people with OCD. OCD is kind of fascinating in a way. It's always the thing I use to talk about cultural presentations of mental disorders. Because when I did my training, I trained in the late 90s, early 2000s was when I was kind of doing my training. And lots of people who lectured me had, you know, teaching us how to do therapy with OCD. All of their examples centered around, not all of them, but many of their examples centered around people who had a fear of contamination with HIV. And of course, they were practicing during the AIDS crisis in the 80s and 90s. And I wasn't. Things changed. So I have often people who I've worked with OCD, it's much more common they have concerns around terrorism, or pedophilia, people who think they're pedophiles even though they're not. And more recently, COVID and pandemics. So it's really interesting to me just to see how much culture impacts presentation of illnesses. And I think it's the same with NPD, actually. You'll see different presentations in different cultures, so, I think And Jacob, nameless narcissist, often talks about how he isn't brash or rude to waiters or things like that because he's from the Midwest. So he values politeness and good manners. So he would never do that, you know. Um, so it is interesting, I think, to think how different disorders present differently in different cultures. So, hey, Mac, how does dissociation mix with flashbacks? There is stuff that I can't remember when I'm trying to, but I remember stuff sometimes if I'm sitting on a bus on my own. Well, kind of like so. It's kind of different. Dissociation is like when you're really cut off from your experience and you kind of like going to another place. And certainly, if you're having a flashback, can also be dissociative because you can lose contact with the current reality and you can kind of lose yourself in the flashback. But it can also be that the dissociation, it's, there's individual aspects of these experiences. And I think dissociation is used to refer to a quite a wide variety of things. So some people, the dissociation is like zoning out, numbing, and being completely unaware of what's going on. Other people, the dissociation is much more getting stuck in a flashback and they can even start to act and feel like they're back in the past and they almost lose touch with the present reality because they're in a flashback. Um, so they are certainly related. And yeah, like losing chunks of time is that's quite extreme dissociation. And then getting lost in your neighborhood, walking your dogs twice, getting lost in stores, thinking you were someone else. That is really tough. Would you be rude to them if you knew they weren't going to spit in your food? Okay. Do you guys have more questions or anything else we should talk about? Actually, I'd love to know, do you guys have anything you'd like me to react to? Because I think I'd like to do more reaction videos. I did quite enjoy doing it. Took me a long time to edit though. So I don't but maybe if I'll find a way to do it a little bit more quickly next time. Um, but yeah, let me know if there's anything else you want me to react to. And if not, I might think about tying it up now because it's quite late where I am and I've had a busy weekend, so I may well just think about going to bed. But it has been fun as always to chat to you guys. And yeah, Amelia, that's tough. So yeah, that's like the experience of dissociation where you feel that almost sounds like something called derealization, where you kind of start to feel like the world around you isn't real, or like depersonalization, where you feel like you're not real anymore. And they're both forms of dissociation. But anyway, it has been fun. It has been great to talk to you guys. I will try to be here again next week at about 9 p.m. UK time, which I think is 4 p.m. Eastern. And after that, you're going to have to figure it out for yourselves. But it has been so much fun. Thank you so much. And hopefully, I will see you next time. Take good care.